Hi there, this is Jonathan Ginsberg. I'm a Social Security Disability attorney, and today I'd like to talk to you about Social Security Disability and neuropathy. And neuropathy is where you have nerve pain radiating into your arms or your legs. It can be very, very painful. It can be very difficult to treat. And when I'm looking at a neuropathy case, I'm going to start by looking at the listing, and there actually is a listing for neuropathy, 11.14 peripheral neuropathy under the neurological listing. My experience has been it's difficult to meet that listing simply because judges a lot of times feel like, first of all, that if the neuropathy was really, really significant, that the adjudicator would have caught it. And many times the neuropathy can be caused by a number of different things. It can be related to a herniated disc. It can be a result of something idiopathic where we don't know exactly what it is. It can be reaction to a medicine. It can be reaction to, for example, chemotherapy, things like that. It can be a number of causes. And judges like a direct cause and effect. So again, if you've got neuropathy that arises from a herniated disc, then maybe you could make an argument for the listing. But most of the cases I see at hearing are going to be argued on a functional capacity evaluation or a grid rule argument, simply because I think the really serious cases of peripheral neuropathy are caught earlier. So I don't normally see judges approve cases on that theory, on the listing theory, at a hearing. So if we're at a hearing and we're going to argue for functional capacity, what we're saying is that your capacity for work has been so greatly reduced by the nerve pain and the weakness associated with that, that you would not be a reliable employee. Now, a judge will expect to see specialist treatment. So your family doctor saying you've got neuropathy is not enough. You really need to see a neurologist, somebody who can do nerve conduction study tests, EMGs, things like that, so that the judge can really objectively can determine that yes, there's an objective cause, there's an objective proof of your neuropathy. And a nerve conduction study can be very painful, actually, but it can show that there's problems with nerve conduction into your extremities. Judges are also going to expect to see that you're on pain medications such as neurontin or gabapentin, it's the same thing, that deals with nerve pain. Many times these medications are not especially effective, so you can have a high level of nerve pain. I think that, as I mentioned before, causation is important. The judge will want to know, if at all possible, what's causing the nerve pain. Is it a disc problem? Is it a reaction to a medication? Is it some other disease? I mean, I've even seen it from some tick-borne diseases, things like that. So there's any number of causes for neuropathy, and again, sometimes there's not a specific cause. It could be a number of different things, but whatever the cause is, if you can identify one, that is actually very helpful. I think that when you testify about nerve pain, you don't want to go in there and say, my level of pain is a 10 at a 10-point scale all the time, 24/7. Judges don't find that credible. You want to talk about that in a worst-case situation, when I overdo it, or when the weather changes 3 or 4 hours a day, 3 days a week, it gets to the point where I simply have to lie in bed. I can't stand it. I'm taking medications. I can't do anything at all. But there are other times when the pain may be at a 4 or 5, where I can do a little bit of functioning. Be realistic about your testimony. Don't want to say that everything is unbearable 100% of the time. Most of the time, judges will not find that credible, which leads me to my final point, and that is practice with your attorney. You want to make sure that when you discuss your nerve pain, that you've discussed it with your attorney and practice answering questions that you're likely to get. You learn how to describe your level of pain. Some judges don't like the 1 to 10 scale, so come up with a different way to do it. Learn to describe where the pain is, what it feels like. I've heard people say, my pain feels like a toothache in my elbow. Well, that doesn't really say anything. Is it a sharp stabbing pain? Is it something that you cannot focus or concentrate when the pain is at its worst? Discuss with your lawyer some good ways to describe that level of pain. Describe where exactly it exists. Is it in your arm? Does it radiate to your fingers, to your thumbs? Does it impede your grip? Does it make it difficult to lift things? Again, you want to focus on those things that would be necessary to perform a simple entry-level job. And if you're saying that your nerve nerve pain or pain in general is that severe, you need to be really, really specific and very, very credible, because judges, when they look at pain cases, let's call them, they're very, very cynical about it, because a lot of people walk in there to hearing office and say, I'm in terrible pain, approve me. You want to make sure that you're describing your pain in a very specific way and that it's consistent with the medical record, and that if at all possible you have support in the form of a functional capacity evaluation or a narrative report from a treating specialist. That goes a long way to winning a neuropathy case. I hope you found this helpful. If you did, please give it a thumbs up on YouTube, like it on Facebook, and if I can be of assistance to you, please let me know. Thanks a lot. Hi, this is Jonathan Ginsberg, and I hope you found this video helpful. If you'd like to know more about how to win your Social Security disability case, I'd like to invite you to download my Secrets to Getting Approved Early Survival Kit that I created just for people like you. Currently, I'm making the survival kit available at no cost, and I encourage you to grab your copy now. Some of the topics I cover include: how do I know if I have a case? Is it the right time for me to file my claim? 9 common mistakes that can doom your case. The 3 must-have arguments you use to win your case. And a topic that every disability claimant wants to know: how to avoid trick questions from the judge. If you or a loved one need to win Social Security disability benefits, you'll find the Survival Kit essential reading. Download your Survival Kit right now and at no cost. Just visit ssdanswers.com/survival and sign up. It's that easy. Please act now. And as always, I wish you the best.